Glaucoma is a condition in which the delicate fluid pressure inside the eye gets out of balance. This pressure buildup can lead to gradual but irreversible damage to the optic nerves. Left untreated, blindness can result. There are several types of glaucoma, but the most common is called chronic or open-angle glaucoma. The pressure in the eye must be maintained at a certain level in order for the eye to hold its shape. This pressure level is maintained by the constant production of a fluid called aqueous, which then flows out of the eye at a constant rate. This aqueous fluid is totally unrelated to tears, which occur outside the eye. Inside the front of the eye, aqueous is produced by a structure called the ciliary body. The fluid gradually flows around the lens and through the pupil, eventually to return to the bloodstream through a drainage network called the trabecular meshwork. Sometimes the drainage process stops working properly, and pressure begins to build, not just at the front of the eye, but also at the back, where the delicate optic nerve is located. As the tiny fibers of the optic nerve are damaged, vision is gradually and permanently lost. Side vision is usually affected first, and vision will eventually appear as though you were looking through a tunnel. Chronic open-angle glaucoma is one of the leading causes of blindness, because by the time a person notices any vision loss, the damage is well advanced. But most glaucoma cases can be treated with great success, and the vision loss is usually preventable. The key is to have your eyes examined by a doctor regularly. This is especially important if you are over 40, diabetic, very nearsighted, or have a family history of glaucoma. The pressure inside your eye will be measured with an instrument known as a tonometer. This pressure varies greatly among individuals, with the vast majority of people having pressure that ranges from 10 to 20. This pressure will also vary throughout the day. Just because you have a pressure reading higher than 20 doesn't necessarily mean you have glaucoma, but your doctor will want to monitor your condition more frequently. As a part of your examination, the doctor will look at the internal structures of your eye to see if there are any noticeable changes in the optic nerve that may be indicative of glaucoma. Your overall visual field will also be examined using one of several reliable instruments. Since chronic glaucoma first affects your side vision, this test will indicate whether your peripheral vision is normal or decreased. Photographs of your retina may also be taken to use for comparison in subsequent regular examinations. Another common test is called gonioscopy. Using a contact lens with angled mirrors, this test allows the doctor to examine the drainage system inside the eye. Glaucoma cannot be cured, but it can usually be controlled. The treatment program will vary from one patient to another, but generally includes the use of eye drops, ointments, or pills, and will certainly include regular testing to monitor the condition of the eyes. Strict compliance to your doctor's orders is absolutely essential. Some glaucoma medications can cause side effects. You may be advised to apply them like this. Sit down. Tilt your head back to a 45-degree angle. Place the bottle on your brow and look directly at the tip of the bottle. Gently squeeze the bottle and a drop will fall. Close the eye. Put your index finger between your eye and your nose and apply pressure for 2 minutes. This prevents the medication from entering the nasolacrimal system, thereby minimizing the chance of any side effects from the medication. For those whose condition cannot be successfully controlled with medication, there are other options, including laser treatments and microsurgery. In either case, the goal is to relieve the pressure inside the eye by creating a new passageway through the blocked drainage system. Sight is the most precious of our senses, so take care of your eyes. You don't want to miss anything.